Case Study B, The Student Who Laid It on the Line, by Brittany Jones, Liz Flores, and Trilby Elam. It is April, just 3 weeks from dental hygiene graduation. Cody is a dental hygiene student who is ready to graduate from his community health center clinic rotation. Cody has already accepted a position at a suburban practice, which he will start this summer after licensure. On his last day of his rotation, Cody is swamped with an overwhelming amount of patients that are assigned to him. During his third appointment of the day, Cody decides to lay it on the line with an extremely volatile patient named Rosa. Upon noticing that Rosa had ANUG, Cody was busy with a line of other waiting patients, grew tired of listening to her excuses for noncompliance. He decided to lay it on the line. He said to her, "If you don't want to take care of yourself, there isn't much I can do to help you." Then Cody walked away to assist other patients. Shortly after, Rosa stood up from her chair and proceeded to leave the clinical area. However, before exiting the facility, Rosa told Sandy, the front desk clerk, what Cody had said to her. Rosa said she did not want to bother anyone with her problems and would not be seen there anymore as a patient. Sandy relays what Rosa had told her about the incident to Cody's clinical instructor, Mrs. Barnhart. With the situation explained, let's learn more about the individuals involved. Cody is a second-year dental hygiene student who is about to graduate. He is male, Caucasian, 25 years old, and single. Following graduation, Cody is looking forward to working at a busy suburban practice beginning in the summer. Rosa, Cody's third patient of the day, is obese, female, Hispanic, 37 years old, is a long-standing patient of the clinic, and as far as Cody can tell, she has ANUG and poor oral home care. Despite the standard patient information referenced in most clinical charts, Cody missed opportunities to retrieve more details about Rosa's background information. These details would have given Cody more of an insight into Rosa's life struggles and why she was continuing to neglect her home care. For example, Rosa is a mother of 3 children whose ages are 2, 3, and 5 years old. Also, Rosa works 2 jobs because her husband left her 6 months ago. Rosa has several health problems which influence her oral health issues, specifically diabetes. As you can imagine, all of these stresses have caused Rosa to be severely depressed and consequently neglect her oral health. So what is the problem with the student-patient interaction? This incident was obviously not Cody's finest moment for the following reasons. He communicated inappropriately to Rosa, failed to probe her background information further, displayed a complete lack of empathy, and finally contributed to the clinic's loss of a long-standing patient.
Cody, do you have any idea why I needed to speak with you in my office?
I am not sure.
I have called you into my office because I'm not happy with how you treated a patient in clinic this morning. The patient was Rosa Montes, and she claims that you told her, if you don't want to take care of yourself, there isn't much I can do to help you. After you told her this, Rosa left the clinic and told Sandy that she doesn't want to bother anyone with her problems, so she will not return as a patient. Cody, I would like to know why Rosa had this experience.
Mrs. Barnhart, I had a lot of patients assigned to me today, and I think that I was just overwhelmed. Also, this is the 4th time I have seen Rosa, and she refuses to take care of her teeth or use any of the oral home care recommendations that I have given her.
I understand what you were saying, Cody. You did have quite a number of patients assigned to you this morning, and I can see why you were overwhelmed, for fear of falling behind on your schedule. Also, I can see how you might be frustrated when a patient does not follow your instructions for improved home care. However, you do not know what Rosa is dealing with outside of your chair. She currently has a lot of other things going on in her life that you are unaware of.
I am sorry, I did not know about any of this. No wonder she is struggling with her home care and paying for my recommendations.
You did not know because you did not ask, because you were overwhelmed. Sometimes when we are stressed about a situation, we can miss a lot of things that can help us help our patients. Rosa was a long-standing patient of this clinic, and I would like to keep it that way.
I understand, and I am sorry. What can I do to fix this situation?
I think Rosa deserves an apology. What do you think?
I agree. Maybe I should try calling her and apologize immediately.
Yes, that is a good start, Cody, but I also think that you need some time to reflect on this situation a bit longer. I would like for you to come up with an alternative way of how you could have better handled this situation. Your alternative action must demonstrate empathy and discuss what could have been done differently.
Okay, I can do that. Again, I'm sorry about what happened. When do you want me to have this turned in?
Please email it to me by 5 p.m. on Friday. One page will suffice. Also, let me know if you have any additional thoughts or a better method of addressing this matter to ensure that this is a one-time occurrence. Cody, before you leave my office, I would like to say one more thing. This situation is one that you will experience often in private practice, especially at the office that you will be working at here shortly. In order for you to be a successful hygienist, I want you to keep this situation in mind, as well as what you have learned from it.
Mrs. Barnhart sees Cody in the hallway and asks him to meet her in her office around 2 o'clock in order to discuss an incident in clinic, which had occurred earlier that morning. Cody enters Mrs. Barnhart's office and sits down across from her. This type of interaction is known as the sit-down. In this scenario, Mrs. Barnhart utilized several communication strategies to facilitate Cody's learning from this experience. She was clear and concise when she described why she had taken Cody into her office for a discussion. Surface paraphrasing and exploration was used to see what caused Cody to act inappropriately towards Rosa. She used attentive silence and active listening while Cody explained why he had treated Rosa in such a manner. She paraphrased Cody's answers to show that she understood his perspective. She provided corrective feedback which focused on the behavior and its effects. She described what was wrong, why it was wrong, and how it can be corrected. Lastly, she highlighted the importance of having empathy when treating patients. Did you know that approximately 93% of interpersonal attitude is communicated non-verbally? This comes from DeLongis 2016. In seeing the instructor's nonverbal gestures, facial expressions, tone of voice, etc., it can help build value and create an understanding of why a student's actions need to be reviewed or discussed further. 2 nonverbal communication techniques used in the discussion between Cody and Mrs. Barnhart were purposeful eye contact and tracking. Before moving forward to the last slide that addresses the required questions for this presentation, I would like to take a moment to discuss an alternative way that Cody could have handled his discussion with Rosa. Cody could have asked questions such as, "Rosa, the last few times I have seen you, it seems like the health of your gums and supporting bone have taken a turn in the wrong direction. Besides the struggle of controlling your blood sugar, are there other things going on in your personal life that could be contributing to the increased bleeding and pocketing I'm seeing today? What changes have you made in your home care routine since I last seen you? Any significant changes in your diet that could be causing your diabetes to spiral out of control?" The importance of probing patients' backgrounds further cannot be stressed enough. Have you ever finished treating a patient just to have the dentist come in for the exam and your patient starts telling the dentist all the medical changes they have had in the last month or so, including a heart attack or bypass surgery? You had asked them at the beginning of the appointment, but they declined any changes thinking that they weren't relevant to dental cleanings and checkups. This is another example of why giving specific examples to changes helps cue the patient into what type of information is pertinent on their medical history. This slide addresses the required questions that go along with our case scenario. Question 1 says, "Has the situation happened to you in the past, and if so, how did you handle it?" Luckily, all 3 of us working on this project have not experienced this. However, we would have handled it in a much similar way as the previous instructor-student scenario portrayed earlier in this presentation. What approach would you take with the student to ensure feedback is valuable? By utilizing formative feedback by writing comments in response to the reflection exercise and communication during the student-instructor discussion. Verbal and nonverbal communication during a one-on-one discussion is another way to ensure feedback is valuable. Third question says, what would you do to help the student self-assess their performance? By asking open-ended and guided questions, it will help the student form a solution to the problem. Additionally, a reflection exercise could be assigned to the student. Number 4, what real-world advice would you give the student about his actions today? The situation of a non-compliance will unfortunately occur often in practice. As hygienists, we have to ensure that every patient is treated with respect and given our full attention. I hope this presentation and the examples supplied provide a clear understanding of a few different communication techniques that can be implied to have successful communication and ultimately more thorough student learning. Thank you, and we hope you have enjoyed our case study presentation, The Student Who Laid It on the Line.